Most people who get COVID-19 will experience mild symptoms, and many will never have to be tested. But Redfield did reiterate a warning about travel for certain groups of people.
We have recommended that the elderly and vulnerable, including children with chemotherapy and others, should really reconsider at this point travel.
We'll go away, just stay calm.
Some people will be questioning why this issue is getting so much attention when seasonal flu claims thousands of lives here every year. And the reason is this is a nastier, this is a more virulent virus than flu, and it has the potential to have a far greater impact. And we have no vaccine yet, as we do with flu.
But in terms of whether the NHS can cope, when, you know, Matt Hancock talked about the worst possible scenario, how worried are you?
So the worst possible scenario is very bad. There's no question about that. This is, if we're right, the indications for this virus are that this could be a very serious incident, much more serious than we've had for many, many years.
We'll go away, just stay calm.
If you're a person with an underlying condition, and you are particularly an elderly person with an underlying condition, you need to think twice about getting on a plane on a long trip. And not only think twice, just don't get on a cruise ship.
Meanwhile, near Seattle, at the heart of the nation's coronavirus outbreak, more deaths announced today. A wake-up call for the community now even more cautious.
I think as a region and as a state, we do not yet have enough testing capacity. Because we did not have adequate testing, both because of the CDC rules about who could get tested and the very few numbers of test kits we had, we really missed how widely this and quickly this disease was spreading.
Tonight, growing frustration in Seattle at the nursing home now linked to 16 coronavirus deaths. The facility where residents are at heightened risk, saying they need more help. Kathy Jackson believes she may have been exposed to the coronavirus at the Life Care Center at Kirkland. She says the path to getting tested was the hardest part. Call after call to the local health department turned into a chase for answers, delaying her diagnosis.
The U.S. has done a very good job on testing. We had to change things that were done, and the testing has gone very well. And when people need a test, they can get a test.
Trump saying he has not been tested, despite spending time with 3 people, including his chief of staff, who are self-quarantining after coming into contact with a man who has tested positive.
I feel extremely good. I feel very good. There's no symptoms, no anything.
Jay Inslee says the state is now bracing for an explosion of cases.
In 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week it'd be 120,000, and the next week it'd be 250,000.
We'll go away, just stay calm.
One of this country's top experts from Harvard on viruses who has a startling prediction.
The number that I think is grabbing a lot of people is this estimate. 40 to 70% of the world's adult population could be infected.
It's going to take a toll. If it really does spread as widely as that projection says, and that's what I think is likely to happen, then there are going to be millions of people dying, and I don't think there's any way to get around that.
Well, SARS was supposed to be bad, bird flu was supposed to be bad, the 2009 flu was supposed to be bad, and it wasn't. I'm not going to subscribe to the sky is falling.
This is qualitatively different from SARS and MERS in the sense that it is 10 times bigger than SARS already, or more, or about 10 times bigger than SARS. And it is way more widespread, and it is clearly not under control in the way that SARS was.
We'll go away, just stay calm.
I've been working on epidemic preparedness for about 20 years, and completely dispassionately, without elevating the temperature or speaking hyperbolically. This is the most frightening disease I've ever encountered in my career, and that includes Ebola, it includes MERS, it includes SARS. And it's frightening because of the combination of infectiousness and a lethality that appears to be many-fold higher than flu.
We'll go away, just stay calm.
The demand on healthcare providers is surging.
We're going to see a complete overwhelming of the entire medical system for the United States. My guidance is this: if you're feeling ill, or if you're in that high-risk category, avoid as much contact as you can with others.
We'll go away, just stay calm.
I mean, you can see the effect that it's had, that these sorts of strategies have had in Wuhan, in China. It has stopped the epidemic there, and it was really raging at one point. Now, we're not going to do anything anywhere near as stringent as that, but nevertheless, we can almost certainly slow the epidemic down so it doesn't put so much pressure on the health service.
The government is talking about this policy of containment.
Now, we're not going to do anything anywhere near as stringent as that.
Drastic lockdown sent thousands rushing for trains out of Milan. 16 million people are now quarantined, a quarter of Italy's population. No one can leave or enter. Hospitals are being overwhelmed by the virus, said the Prime Minister.
Now, we're not going to do anything anywhere near as stringent as that.
Italy now the worst hit country in the world. 133 new deaths in just one day, 366 now in all. And today, more than 1,400 new infections.
We'll go away, just stay calm.
Well, it seems barely conceivable that a country in the heart of Europe could be in lockdown in peacetime. This is how Italy's cases have grown over the last month, slowly at first, but now more rapidly. But look back 2 weeks when we had the same number of cases as Italy did back then, and the shape of the curves are very, very similar.
We will see many thousands of people infected by coronavirus. That's what we're seeing in other countries.
But the government isn't sharing that evidence with us. It stopped releasing information last week on how many UK cases are catching the virus here rather than bring it in from abroad. By contrast, in Singapore, the public is given full details of the links between individual cases, where they picked up the virus, and their condition in hospital. But cases in the UK are doubling every 2 or 3 days.
We'll go away, just stay calm.
There will no longer be a red zone. There will no longer be a zone 1 and zone 2 in the country. There will only be Italy, a protected zone. So across the whole peninsula, people should avoid all movement.
It is almost everywhere else in Italy. These were rare scenes filmed inside a hospital in the northern town of Cremona. And also on lockdown, the financial capital Milan, one of the engines of the economy. Europe's major stock markets from Milan to Frankfurt, Paris and London all suffered dramatic falls on Monday, with share prices plummeting as the infection rate soars. With more than 60 million people, the country's entire population under lockdown from Tuesday, after another spike in deaths from the coronavirus. All public gatherings are banned and schools and universities closed.
Now, we're not going to do anything anywhere near as stringent as that.
This is a more virulent virus than flu.
We're going to see a complete overwhelming of the entire medical system.
How worried are you?
So the worst possible scenario is very bad. There's no question about that.
This is the most frightening disease I've ever encountered in my career. It's frightening because of the combination of infectiousness and a lethality that appears to be many-fold higher than flu.
There are going to be millions of people dying, and I don't think there's any way to get around that.
We'll go away, just stay calm.